Thanks for your time, Doc. Appreciate it. So we've been hearing stories about understaffed health facilities across the country, about workers simply unable to manage the numbers. Do you think the latest restrictions announced will ease the pressure on the system?
Good evening. Well, time will tell, but one can be confident that it appears that we have learned the lessons that COVID very severely teaches us, and that the government has applied its risk-adjusted strategy very meaningfully. And I think the country has a debt of gratitude to the President for putting forward a very cogent set of conditions that we should adhere to during this period. The situation in hospitals varies around the country and from private to public. We all know about the very severe problems in the Eastern Cape, for example, but these problems will manifest in other parts of the country as we move along the second wave. However, it must be said that the very reasonable restrictions that have been announced will have an impact, particularly those prohibiting large gatherings. These have been the main cause for precipitating the second wave.
Doctor, we are hearing some reports that even private hospitals are suffering severely under pressure, that there aren't enough beds. Are you able to give us an update on the pressures in the private sector as well?
The private sector hospitals experienced pretty much the same situation during the peak of the first wave, where they were overwhelmed and had to divert patients away from their facilities to others. On the whole, however, they coped. And I expect that they will do so again. Clearly, the numbers in the Eastern Cape and the Garden Route are of such a nature that the available beds are probably already saturated, and that more outlying facilities will have to be accessed, or field hospitals, as the case may be. But for now, I think the situation is within what are referred to as hotspots. And if the mitigation measures put in place by the state are diligently applied, we may begin to see a lowering of pressure. The issue for healthcare workers is particularly worrying. It has been all throughout the year, the lack of support they've received in many parts of the country, and this has still, reared its head on occasion, and it's beginning to become more common again. So perhaps a stronger focus by the state on health facilities and healthcare workers will go a long way towards alleviating the crisis. You have to understand that if healthcare workers are infected, you're taking them out of the system and you actually don't have replacements. So the burden falls on the remaining health workers. And that is a cascade that is very difficult to manage. So what the President did very well, I thought, was really appeal to people. Don't get sick. Avoid all of those situations where you could become infected, and asking the infrastructure of business and of the state to play their part accordingly.
Very quickly, Doc, you say that the President made the right moves here, but in terms of actually helping out with the understaffing that we're seeing at public healthcare facilities, how does that happen to ease the pressure? Because we're not hearing a plan regarding that.
Yes, I think you're correct. And I think until a plan is elaborated and made public transparently, I think your question is going to be a question that many people will continue to ask. What we can do only for now is monitor what is happening in facilities. There should have been much more health resources distributed far more quickly and by now. And the fact that that hasn't happened probably speaks to state incapacity, and also the fact that provincial authorities are running off their own bat here, and the degree to which the national department can assist, I think, is quite limited. That being said, I'm sure they're aware that they have to make these moves. It's the fact that we have political structures that may not quite understand how to do this that may be a problem. And unfortunately, that even though we have some pretty tight restrictions in certain areas, we are going to see the effects of this second wave really coming to the fore in January and February. And if we can get our facilities up to speed for that, that would be a very good thing.
Thank you so much for your time and your insight. Appreciate it. That's Dr. Aslam Dasoo from the Progressive Health Forum.